Okay, for just a minute, we're going to focus on the foramina and canals, the various features that are actually holes or indentions in the skull that we can see. So we're going to start on the outside, on the face side, so the most anterior portion of that skull. And then we're going to move around looking at it from the bottom view and from the inside view. And if you'll notice, the way I've organized things on this list is they're kind of grouped together. Some of the ones that are going to be near the mouth, near the mandible, are grouped together as well. And then some of the ones that actually we can see on the inferior view of the skull, we can also see on an inside view of the skull. So if we actually cut the skull open. All right, so let's start at the top with the supraorbital foramen. And as you can see here, it's put in parentheses as the supraorbital notch. I will accept either on the test. However, on actually most of our skull models, it's a notch. It's not a foramen. So most of you that are looking for a foramen would look for a hole. So supra means above or super. Orbital, this is your orbit. So we'd be looking for a foramen or a little hole right here. There's not one. But what you actually can see is there's a little bit of a bump right there and right there. So that's the supraorbital notch. Again, I will accept foramen on the test, but if you're looking for a hole on the test, you're gonna have a hard time finding it because our skulls have notches. So that's a slight difference from individual to individual in their skulls. All right, and then if we look at the features of the orbit, we can see it almost looks like there's this X shape. One line here, one line here, one line here, and one line here. Okay, these are the orbital fissures. So on either side, we have a superior orbital fissure and an inferior orbital fissure. So those holes that are these really deep, wide, long lines. All right, and you can see a little hole near the back, and that's the optic canal on either side. So right there. And we'll talk about the optic canal when we open up the skull in just a minute as well. All right. And then as we work our way down on the face, we see a hole on either side. So that's got to be a foramen. And in fact, it is. It's the infraorbital foramen. So infra means inferior or below. So the supraorbital notch, the infraorbital foramen. Next, we have the incisive foramen. So this actually, if you think about your incisor teeth, okay, that's where the name comes from. To see this, we actually have to look on the inside of the model. And in fact, those are those two little dots, okay, on the inside of the mouth, near the back, right around where our thumb is. So that's the incisive foramen. And then if we were to look at essentially what would be the equivalent foramen for the jaw, for the lower portion of teeth, where a nerve can come through, we have the mandibular foramen, obviously on the mandible. And so to see the mandibular foramen, we basically have to look from the inside view of the teeth, okay? And you can see it right there on either side. That's the mandibular foramen. And then finally we have the mental foramen, and so that's the dot on either side here, that little canal, mental foramen there and there. So mental, on the inside of the mandible we have the mandibular foramen. And then on the maxilla we have the incisive foramen. Next we're going to move to the deeper inside model, or deeper inside view of the skull. So I just pop the top of the skull off. This is the anterior side, this is the posterior side, so the face is right here. And remember, this is the frontal bone and the sphenoid bone. We've got the temporal bone on either side and the occipital bone back here. So we're going to see a lot of the stuff in the occipital and temporal bone when we look at the opposite view, the inferior view rather than the superior view. Okay, so working our way from the most anterior, all right, within the ethmoid bone, we actually have these little teeny tiny foramina, these little holes we call the olfactory foramina. So I'll try to zoom in a little bit. You can see the little dots. So that's important for the sensation of smell, to have those little holes, the olfactory foramina. And then as we work our way into the sphenoid bone on either side, just inside of the lesser wings, we have the optic canal. So if we actually look at this, that optic canal connects with that little hole that we saw from on the other side with the orbit on the face.